Diabetes mellitus. I'm sure you're all familiar with the term, what we just call diabetes from now on. But what exactly is it and what does cause diabetes? So let's talk about it. Actually, we're talking about a group of diseases which all have in common that one has elevated blood sugar levels. There are 6 subtypes. The most important ones are type 1 diabetes, which is genetically inherited and occurs in children or also adolescents. Gestational diabetes, but mostly we're talking about type 2 diabetes. This is the subtype that is associated with overweight and is very common due to an unhealthy lifestyle. So now let's take a closer look at epidemiology, pathophysiology, phenotype, diagnosis and treatment of diabetes. So over 460 million adults live with diabetes. Approximately 90% of those suffer from type 2 diabetes. It's more common in developed countries as an unhealthy diet and also less physical exercise promote the development of it. Over 1 million people die annually due to diabetes. Another 2 million due to associated complications, including heart disease and also stroke. But what causes diabetes? So we have beta cells in the pancreas, depicted here, which produce insulin, which you see here, a hormone that is required for uptaking glucose into our cells. If you think back to the biochemistry lessons, you might remember that glucose is essential for producing energy, so ATP. Now, in type 1 diabetes, the cells are lost, which then leads to a deficiency in insulin, and these cells are lost usually due to an autoimmune reaction. Now, in type 2 diabetes, we have a resistance to insulin. So we have sufficient hormone, but the receptors do not react as they should. So, and this is astonishing, the specific mechanisms are still not clear, but it's hypothesized that the insulin receptor might become resistant. Now, constant high glucose levels detrimentally influence the body, and above a specific concentration, the kidneys can no longer reabsorb it. And the urine contains glucose. This glucose then attracts water and thereby the patients lose water. While the onset of type 1 diabetes is sudden, it gets progressively worse for type 2. Now let's talk about the phenotype. So first signs might include weight loss, increased urination, thirst and also hunger. Those symptoms might be severe for type 1 diabetes, while some may not notice them in type 2. There are also unspecific symptoms including headaches and also fatigue. On the long term, it might cause vision loss, which is called diabetic retinopathy, and also skin lesions. There are other complications like diabetic ketoacidosis, and this is a metabolic disturbance. This might become life-threatening and has to be treated. Now, when we're talking about diagnosis, it's comparatively straightforward as elevated blood glucose levels can be measured. And then there are specific thresholds which give information to what extent someone might have a glycemia, which is an increased glucose level, or an impaired tolerance, up to the fully manifested diabetes. Glycated hemoglobin, which is called HbA1c, gives information about the glucose levels for the last 3 months. And here you see the hemoglobin with its glucose. Now, when we're talking about the treatment, in the early stages of diabetes type 2, a behavioral change might improve or even reverse the symptoms. Changes might include weight loss and following a specific diet. There are, of course, also many drugs used for pharmacological treatment. They can control glucose levels and lower blood pressure. In general, supportive measures are essential. All those treatment options have in common that the main goal is to decrease blood sugar levels to a more or less physiological level, as this is most beneficial. Now, in general, as type 2 diabetes is by far the most common subtype, and this is actually a preventable metabolic disorder when following a healthy lifestyle, for example, having a normal body weight and following a healthy diet, as well as sufficient physical exercise. And there's also a strong association between smoking and diabetes. So you might want to adhere to those recommendations as they substantially lower one's risk for developing diabetes. Now, this was a quick introduction into this actually very common metabolic disorder. If you like this video, don't forget to give it a thumbs up and to subscribe to the channel to see weekly uploads on scientific topics. See you in the next video.